I'm so excited to feature Hillary Lynn, MD, on this week's session of How I AI Clinician Edition. So, Hillary, you have been so fascinating to me since we met about a year ago. And just not only are you leading longevity clinician, you're a founder. So, you're bringing this unique angle into your practice that I think many clinicians don't have. So, first of all, tell us about one of the ways that you're using AI in your personal practice today, which you're running on the side of being a founder today.
Yeah, I think one of the most important things is because I run a longevity clinic, I always make sure that I'm really on top of the research. And so I'll use AI frequently to double check research, like evidence essentially, behind different supplements or different interventions, medications, and even what certain combinations of lab results might entail in terms of meaning. And I will double check what the latest research is. And frankly, some of the fastest ways are using AI tools. You always want to double check, of course, like by checking the references and reading through them briefly. And then because you'll undoubtedly end up with like 5 different papers, you can sometimes use AI to summarize and synthesize all of that info too. So basically, I'm using it as very much a copilot there so that I can be up to date and then really treat each of my patients as an N of one.
Love that. Do you have a preference in tool, ChatGPT, Claude, multiple ones that you're testing out?
I use all of the major LLM tools. And this will change day to day, but just to give you an idea of why I choose one or another, ChatGPT right now with GPT-5 is a pretty good general tool. It does choose for you the model because of usage limits.
Mhm.
So sometimes you use it too much and it gets dumber and dumber. But it's also generally quite good for making images. I also create content, so I use it for making images. Claude is probably the quote unquote smartest, but it can outthink itself sometimes. And I have found a little bit less good at naturally finding references. Grok
Mm.
is almost my regular go to. It's not necessarily the best reasoning model, but it does a very good job of searching very fast. And so I'll sometimes use it if I want to create like a vast summary on a particular topic that has like clickable references that I can like very quickly double check on. And every so often I'll use Gemini, mostly these days, to use their nano banana image generation tool.
It's amazing. That's great. And what about tools like open evidence? So these are all general models that you talked about, which is really interesting.
Yeah.
Have you been?
Yeah, you know
Yeah.
what's really funny is I'm a big fan of open evidence. When they first came out, I was like, wow, like this is the end of the up-to-date era, and it truly has been. And as the general LLMs have gotten better, what I suspected became true, which is their main differentiator was that they were siloing to medical information, and that was really helpful, especially for users, busy doctors who
Yeah.
can't go and check these references readily. But because I'm in the habit of checking the references so frequently, because I know hallucination can occur, the way I use just general LLMs is effective for replacing what open evidence is good for. And
That's
I will
great.
also note that open evidence favors a more traditional medical practice. And so sometimes
Yeah.
you'll get responses that simply don't align with a more advanced approach that is more frontier focused and more N of one. You'll get guideline based care, which is population based.
Yeah, makes ton of sense. That's what I was actually going to ask you is like, do you prompt Grok or Claude or ChatGPT in certain ways to get the type of research that is more longevity focused or taking this more frontier approach? Like, are you giving it a certain set of guidance to give you back information
Yeah.
that's more suited to your philosophy?
Yeah, I mean, sometimes it's as easy as just saying with a longevity perspective, it's these LLMs, they understand now because there's so much information on the internet what longevity
Hmm.
means. And but also the trick really is to keep talking to it because you'll get better results with back and forth. So I don't
Hmm.
think of anything as like a single shot like response. I think of everything as like, okay, let's constantly refine. And I actually believe this is why a sophisticated AI enabled clinician still outperforms your average, non-clinical user in prompting an LLM, because you're going to ask repeated questions and try to get
Yeah.
around a particular question from every single dimension.
Makes sense. Makes sense. I think what we're seeing across the board in AI is that it's raising the bar, it's raising the floor, right, for people to just know generally a lot more. But it's also making experts like you and the best clinicians out there even more powerful. And it amplifies your expertise by allowing you to dig in versus comparing that to if some layperson like me was asking questions of the LLM. So that makes a ton of sense. I know we're at time. The last question I have for you is just, are there specific prompts that you have found that are your go-tos that you might be able to share with the audience?
Yeah, I don't have any standard ones. I will give you a few ideas of what they are, and then really again I go back to I just have a prolonged conversation most of the time. But
Makes
some
sense.
of my frequent prompts are things like give me the latest research evidence, or give me the latest scientific results or outcomes that has been published on a X topic. And sometimes I'll give it a case. Like, I'll be like, for a 42-year-old female who's considering perimenopause HRT and has these symptoms, like, what should I consider in terms of, testing, or like asking what types of symptoms. So those are the types of things that I might prompt with, but I don't have like very cookie cutter type prompts, because
Yeah.
you'll find after talking to LLMs a lot that, the models are changing, and then you know what you're trying to get at, but it's very much like talking to people. You can't say the same exact thing and expect a reliable outcome every time.
Makes sense. And it keeps, yeah, keeps shifting, keeps changing. Well, thank you so much for sharing your quick thoughts, Hillary. Great to chat with you as always, and
All
love
right,
to
thank you.
learn
Happy to share.
alongside you. Yeah, thanks.
All right.
All right.